Selfhatred Aimba, for those who are new to me. And for those who have already watched our part 1 of this series, in-depth analysis of abortion, welcome again. Thank you for your comments. Thank you for all those who texted me, all those who called me to tell me where I can improve and to say that you enjoyed the video and that you learned a lot. I really do appreciate you, and I want you to subscribe on our channel so that you can get all our videos. I'm going to be tackling your questions at the end of this series. For the newcomers, I have elaborated more on what we do at Pearls and Treasures Trust, but just to let you in, we do crisis pregnancy counseling, post-abortion recovery program. We mentor women and girls to live responsibly, especially in their sexuality, so that they don't get pregnant and they don't choose abortion. They don't have to choose abortion. We also run a teen moms program in the slums. Last time we looked at what a crisis pregnancy is. We also looked at the emotions a woman goes through when she's faced with a crisis pregnancy, and some people prefer to call it an unplanned pregnancy. That's all fine. We try not to call it unwanted pregnancy because no baby is unwanted. It might be a crisis, but no baby is unwanted. So we looked at the emotions she goes through. We looked at how she can be driven to choose abortion, or sometimes how women are chosen abortion for. And therefore, when she chooses abortion, or if somebody chooses abortion for them, what happens to them? What is the immediate emotions? We looked at relief, we looked at justification, we looked at suppression, and then we looked at post-abortion syndrome. And I defined post-abortion syndrome for you to just understand what it's all about. But for the sake of those who are new to this channel, I just want to give you the definition so that you understand where I'm coming from, so that when I'm getting into what it actually is and the symptoms and all that, you have an understanding. So basically, this woman has been faced with a crisis. She's chosen abortion. She's gone into relief mode because the crisis has been solved. Please get all this in our part 1 video. So after the relief lifts, she begins to come face to face with post-abortion syndrome. And the post-abortion syndrome is basically the inability of this woman to process all the emotions she is facing after the abortion. Why? Because the society does not allow her to grieve. And basically, what post-abortion syndrome is the grief that is bottled inside you. And I elaborated very well in our last video that it's like putting pressure in a bottle and locking it very tight. One day that bottle will pop out. And so basically, one day this woman will pop out because there's so much grief and pain in her. So when we go to a doctor, when we feel unwell, what usually happens is that the doctor begins to, ask you questions, and those questions are telling him the symptoms you have. And when he knows the symptoms you have, he can be able to tell what is ailing you before he puts you on the examination table just to confirm. So in the same way, I just want to say that there's some birds chirping in my garden, so don't worry about the natural soundtrack. Just concentrate on me and many other unnatural soundtrack that will come. So anyway, there are symptoms that will make a woman know that you're actually suffering from post-abortion syndrome. And so we're going to look at some of these symptoms. And many women don't know that they're suffering from post-abortion distress or post-abortion stress because nobody talks about it. It's not like malaria, where when you start feeling your joints paining and you're having a headache and you're vomiting and I don't know if you're one of those who had malaria when they were young. I had it so much because I was from a malaria zone that I just know the symptoms. But basically, in the same way, because I'm post-abortive twice, and I was counseled through it, and I was able to help many other women in their pain, I know the symptoms of post-abortion distress. So just to take us through some of them, and I also want to say that a post-abortive woman doesn't go through all these symptoms. They go through some of them. Some go through all of them, to be honest, but maybe in bits and pieces. Some go through very little, So it really depends on a woman. We respond to trauma very differently because we are different in personality, upbringing, maturity, background and environment. I will read out things, and maybe you're post-abortive and you're like, I don't identify with that. That's fine. You'll find at least something that you identify with. And so the first thing that a woman will go through is guilt. And I explained when I talked about the relief mode and then the justification. The reason why she begins to justify is because in the first place, there are guilty feelings. And so she's guilty because she's coming face to face with the fact that she killed her own child. And I explained this in the last video, saying that we cannot argue with the law of nature. In that time that when you're in a crisis and you're feeling like, oh, I have to tell the whole world that I am pregnant, and what will I do? How will I say it? And somebody introduces you to abortion, and you feel like that is your solution. You're still in that crisis mode, and so it's not making sense to you, But your inside know that you're a mother, and so that's why your inside catch up with you when the relief mode has worn off. And this woman feels guilty and feels a lot of shame. There's a lot of shame associated with abortion. And even if they say it is a woman's right, which woman have you ever seen standing up and saying, I had 2 abortions or 10 abortions or 15 abortions? Why? Because it's shameful. That's just the truth. Do not be lied to that it is your choice. When you're alone in that corner after everyone has gone away at night, you're crying alone. You understand that it's not just about choice. You know deep within you what you did was wrong. So a woman who's post-abortive has a lot of shame surrounding her. There's sorrow. Like I said, post-abortion distress is just basically grief. Grief bottled up in a woman, and that grief comes with a lot of sorrow. There's a lot of anger. She begins to be angry at herself for the choice that she made. At that time when she was making that choice, it looked like a good choice. It felt like a good direction to go. But then when she begins to go through all these emotions, she gets angry at herself. She can also get angry at her boyfriend, angry at, as I'm doing the support groups, you hear some of the women saying, I'm angry at the nurse who put down my name when I walked into that clinic. I am angry at the doctor who spoke to me or who touched me when I walked into that examination room. I mean, the receptionist, the watchman who opened the gate, And you wonder, why would you be angry at the watchman? Because all these people are associated with her pain. So it's almost like you're all involved and I'm angry at you, And that's how pain sometimes just comes out. Your perspective is just wrong, Many women are depressed. Some of them don't even know that they are depressed, but they can actually tell, my life changed. There's a lot of anxiety. They don't know what tomorrow holds. There's a lot of panic, a lot of confusion. A big one is self-condemnation, lack of forgiving yourself, and fearing God's punishment, especially those who are religious. And basically, Kenyans and Africans, we are a very religious society. But like I said, you can't argue with the law of nature. There's something within us that tells us, that thing was wrong. And so I've seen women, post-abortive women, finding it easy to receive forgiveness from God rather than forgive themselves. I also really found it very hard to forgive myself because probably you've set up high standards for yourself, or it's just one of those things that it's just difficult to comprehend. Fear of God's punishment, like I mentioned before. Some women associate calamities in their lives or misfortunes in their lives to the abortion, yet they're just natural occurrences. Like, for example, if their businesses are failing, if they've been demoted at their job, or they lost their job, or a loved one died or is struggling with an ailment, or whatever struggles they face, they associated with God's punishment. God is punishing me because of the abortion I procured. There's a lot of rage for some post-abortive women. I have seen that. Some have banged the door at me, because I touched on that wound. And I say, it's fine, just go, you'll come back. And they come back and they go through the process and they laugh at themselves. So I've seen that as well. There's a lot of self-hatred. Actually, what I've seen is self-hatred and abandoning yourself, like you're so unkempt, you hardly shower, and it's also a symptom of depression. You even expose yourself to abusive relationships because you're feeling so worthless inside of you. You're feeling so I don't amount to anything. Look at me. Who can love me, And I think I've shared my own story in the first video where I just told myself no man can marry someone like me, So there's low self-worth and just self-hatred. And I've seen women, when they come into the program, the first week, they're so unkempt. Some of them will tell you, I have not stepped into the salon for the last 1 year, for the last 6 months. True to their words, they haven't, because they don't see any value in themselves. But come to the 6th week, somebody comes with a hairstyle, and I'm like, wow, what happened to you? And there's a big smile, and there's a makeup, and that tells me this woman is healing, because they're beginning to realize, you know what, I was going through pain, and I hated myself, and I felt worthless. But look, this is how God sees me. I am forgiven. I am set free. I am not bound to my mistakes, and I just begin to blossom. So yeah, I've seen that self-hatred and just feeling that you're not worthy of any love and rejecting yourself. I have seen women go through crying spells, terrible crying spells. I remember one of the girls who works in the office right now. Her name is Noelle, and her testimony is in one of the videos in the channel. When she came, if you would ask her name, she'd just cry. So with the first 2 sessions, we did not do anything. We just let her cry. Some women come wailing from the gate. It's almost like, this is where I can find my, I can be able to express myself, let loose. And when you interrogate their lives, you find that it is just full of tears. And they can't understand, they can't tell why they're crying. But it's actually because of that grief of the loss. And I've explained about loss in our first video. Please go back. I will still refer you to the first video. For me, I used to cry. I spent most of my nights crying and my days sleeping. So it was either sleeping or crying. And I couldn't eat because the food just tasted like sand, All I knew to do was cry. And I felt like crying was trying to remove something that was in my heart that I could not touch, that I could not explain, And at that time, I didn't even understand about post-abortion syndrome or post-abortion distress. There's despair. What's going to happen with me? Who am I? What am I going to be? Actually, I used to ask myself, what am I? Who am I was even big. It was good. At least you're a who. You're a person. You can put a person, a personality on that who. I used to ask myself, what am I? That's how gone I was. So if you see a smile on my face, you know that I have really healed. Many women go through nightmares, dreams, flashbacks of their babies. They hear their babies crying. They hear their babies calling their names, at night. And therefore, they can't sleep. They have sleep disturbances. And some of these things, some of the symptoms I'm telling you is actually tied to depression. And with depression comes with suicidal tendencies, thoughts, attempts. I was very suicidal. I tried to commit suicide twice. Thank God that I did not. He saved me from it. And so I know it is real. I know those thoughts are real. I know those actions are real. Now, some of the behavioral changes, some women become very secretive because they're afraid the moment they blurt out, they talk too much, they will spill out the secret. So they become very secretive. They divide their time or their life from before the abortion and after the abortion. So before the abortion, I was this kind of a person. I was a very yappy person. I was a very clean girl. I was a very stylish person. But after the abortion, I don't want people around me. I don't care about myself. My life is just doomed. I don't know about my tomorrow. They can't hope. They can't dream. They can't do anything. There's no zeal for life. They avoid baby reminders. When they see a pregnant woman coming, they turn the other direction. Why? Because that pregnancy reminds them of the baby they aborted, or they cannot bring themselves to hold a baby. When people go for those baby celebrations, I don't know what you call them, they will always stay at home, stay back. Or if they go with you because you're in a chama, you have to go, you will not see them holding that baby. They'll be busying themselves in the kitchen or doing something, to just distract them. But then I've also seen women who get obsessed with babies. I was one of those who got obsessed with babies. Whoa, if I saw a pregnant woman, I'd go and listen on the tummy if the baby is kicking. I'm like, please make the baby kick. And I would feel like, please, I wish this baby was mine, And some women even begin to volunteer in nurseries and things like that, because there's that place, that tender place in their hearts that they want to attach themselves to a baby. I remember one woman who came to our program. Hers was that she just started buying baby clothes, and if you asked her why she's buying the baby clothes, she could not explain, And when she came to the program, she now began to understand it is my insides that are craving for a baby. When I buy this baby clothes, I feel like I'm attached to the baby that I lost. Some people lose their normal sources of pleasure because they feel my life is not pleasurable anymore. Like, what is there to enjoy in life? So you just cut off friends who make you happy. You cut off associations. You just cut off fun things that you do, and you just live a gloomy life. Self-punishing and self-degrading behavior, punishing yourself, like I said, by not taking yourself to the salon, or, avoiding things that just make you happy, make you look beautiful. We've had women come into the program who they tell you, I started taking alcohol after my first abortion, or after the abortions, or after the abortion, one abortion, or drug abuse. There's promiscuity, multiple sexual behavior. I think I explained that in the first video, but for the sake of newcomers, I'll just explain. This one is a big one. Because abortion robs a woman their self-worth, and they feel they're not loved, they're not accepted. They are looking for that acceptance and affirmation. And so you find them getting into multiple relationships, and therefore multiple sexual behavior, and they get into the risk of getting pregnant again. And when they get pregnant, because the first abortion solved their problem, it's easy for them to procure another abortion, and then it becomes a cycle. And that's why you really have to get your healing. Unless you get your healing, you will always look for that love, acceptance, and affirmation in the wrong places. There's difficulty in intimacy. One, because you fear getting pregnant again, or like for me, 1 year down the line, I could feel the physical pain of the instruments that were inserted in me, and therefore physical intimacy for such a woman is just a no-no. And if you're a married woman, then sex with your husband becomes a no-no, because the pain is actually psychological, it's not physical. I want to talk about one other big one, atonement child, because this woman is grieving the loss of her child so much. Some of them will go looking for atonement children. They go looking for a baby. It's almost like in their mind they're thinking, if I get another baby, it replaces the spirit of the other baby. And it's not true. Once you've had the abortion, the baby goes back to where they belong. If you get pregnant again, it's a totally different person. It's not the baby you aborted. And this is the misconception many post-abortive women have. And it's because of the pain and the grief in them, because they want to have that baby back. And so they think, if I get pregnant again, it's that baby that will come into my womb. That's not true. Abortion also makes a woman or a mother have unhealthy relationships with her living children, or the children that she'll have in the future. Some of them become overprotective. They begin to smother their living children or the children they will have in the future, because they're trying to compensate for that baby they aborted, because they're feeling they're such bad people. Let me smother this child with so much love. I don't discipline, I don't, So this woman does not have the ability to discipline their living children, because they're compensating for the baby they lost. While some of them refuse to bond with their living children or with the children they will get in future. They struggle bonding with babies because they feel, I'm such a bad person, I wouldn't know how to take care of a baby. And so they totally disconnect from that child. They can even abandon that child. And so these are the things we need to look at. Many times all these symptoms, you know, alter the way we behave, alter the way we view life, our perspective of life. And that's why we go into coping mechanisms, you know, to help us cope with this pain. Next week, I'm going to look at what coping mechanisms do to a woman, or what they are first and what they do to you as a woman. Because many women have lost themselves in these coping mechanisms. And by the time they come to the program, they don't know who they are. But thank God that we can all heal from any trauma in our lives. So thank you so much for joining me this time. Thank you for listening to me. And I just ask that you may continue commenting, you may continue asking questions. I'm going to tackle all your questions at the end of this video, rather at the end of this series.